Hello, doctor and medical students. I am Dr. Amit. So let's move forward in our beta-lactam antibiotic series, and today we'll discuss about carbapenem group of drugs. So as we all know that carbapenems are a broad spectrum beta-lactam antibiotics, and important drug of this group include imipenem, meropenem, and ertapenem. And these drugs are often considered as a most powerful antibiotic in clinical practice. We often call it as a brahmastra in ICU setting. Now let's talk about its mechanism of action. So while talking about its mechanism of action, it is same as other beta-lactam antibiotics. That carbapenem group of drug also bind to penicillin binding protein, which is also called as transpeptidase, and it inhibits the bacterial cell wall synthesis and finally lead to bacteria death. So this carbapenem group of drug are bactericidal, and they are highly resistant to beta-lactamase enzyme, which is produced by some bacteria. Now let's focus on some important point of imipenem. Okay, so imipenem is a very broad spectrum carbapenem antibiotics, which is very active or strong against gram positive cocci, gram negative rods, and anaerobes. But there is some important point we need to remember to solve MCQ. The drug imipenem is always administered with cilastatin because there is an enzyme called renal dehydropeptidase 1 in renal tubules. So when imipenem reaches there, these enzymes inhibit the drug imipenem. So when we administered it with cilastatin, then cilastatin inhibit the enzyme renal dehydropeptidase and doesn't let this enzyme to inactive the drug. So in another word, we can say that cilastatin increase the effectiveness of imipenem. Now let's talk important point about meropenem. So meropenem is similar to imipenem but has some extra advantage over imipenem. Like this meropenem is stable against renal dehydropeptidase 1. This meropenem doesn't require cilastatin and low risk of seizure compared to that imipenem. And this meropenem group of drug also has a very excellent CNS penetrations and is commonly used in severe meningitis and hospital acquired infection. Now let's talk some important point about ertapenem. So ertapenem has a slightly narrower spectrum to other carbapenems, and the ertapenem doesn't cover the bacteria like Pseudomonas aeruginosa, then Acinetobacter and Enterococcus. So that's why they are not very commonly used against Pseudomonas. So these are the important point of imipenem, meropenem, and ertapenem. Now we'll talk about its clinical use. So we'll continue the clinical use in the next part 2 of carbapenem group of drugs. Thank you for watching.